So welcome to this episode of Clinically Pressed. We are continuing on with our board of director interviews, just highlighting these people and what they do on the board. And with this one, we have one of the original founders of Clinically Pressed, Dr. Andrew Jagim. So Dr. Jagim did his undergrad at the University of North Dakota, making sure we get that right. Grad school at UW-La Crosse, PhD at Texas A&M. We connected originally with Kyle at UWL after he did a stint out in Pennsylvania teaching, and then coming back to UW-La Crosse. Spent some time at Lindenwood, and now is back as the director of sports medicine research at Mayo Clinic Health System in Southwest Wisconsin. So, like the previous interview with Dr. Kyle, just kind of going over some things and getting kind of his insight and really the insight on switching to a nonprofit, which you and I kind of led the charge on as all of a sudden the light bulbs started going off. But just being a founding member, how have you seen like the transition, and just even talk about like your thought process on the idea of going nonprofit with Clinically Pressed and why you liked it, and what kind of we hope to see from this?
I think some of the major changes and even upside of it is it's kind of a much more efficient way to just help people and kind of give back to local community, but then even the potential to expand that to more people kind of in more of a broad fashion. So the way we've kind of structured it, and now just the mindset of how we see the organization kind of growing in the future, it's always kind of coming back to how can we give back to people kind of along the realm, or anything related to fitness and nutrition and safe sport participation, kind of covering all those different sub-disciplines in this space. So I think that's the exciting thing, is now just seeing it as really a vessel to just kind of give back and help people.
Totally agree with you there. So you kind of mentioned a few of the areas that we're focusing on, which is, I feel like, one of our strengths, but also could be a weakness because we are very broad-reaching in our interests, and we try and continue to apply that. What unique skills, experience, knowledge, kind of anything you want to frame it as, do you bring, which people have probably, if you've listened to any of our podcast episodes, you can probably guess where some of this is going, but in making the complicated simple and kind of giving back to the community?
I think a lot of it kind of stems from my background in academia, so just kind of coming up in this field with a background and kind of focus on the science part of it, and then kind of evolving into more of an educator role. I always kind of like looking at kind of the core fundamental aspects of how the science and physiology may impact various aspects of performance and health. So being able to kind of provide that maybe higher level perspective on some of the scientific principles with some of the topics or areas that we focus on, and then trying to translate that in an easy to understand and kind of practical manner. So kind of bridging the gap a bit of how we maybe see things in a lab setting, but then how people in the community can learn from that or apply it in their everyday lives. And as you kind of mentioned, we wear a lot of different hats through a lot of different roles that we've been in. So, I have different experiences being a coach, being a personal trainer, doing some consultant type things. And so through all those different experiences, I think it just kind of helps view things from different perspectives and really kind of help find ways to help people so that they can, again, learn from some of the things that we've maybe studied in a research project, or just kind of learn through some of the educational experiences that we've had.
What have you seen, especially like you said, in some of that kind of personal trainer, consulting, working with people, the biggest barrier or barriers in people kind of getting healthy, active, fit in whatever context that is for that person?
I think a lot of it, and it actually kind of comes down to our tagline, is people like to make things more complicated than they really are, and they kind of stress about it, and they're always trying to seek new diets or new training strategies or just kind of the new fad or fanciest thing, when in reality just little subtle changes but done in a consistent way are really the biggest kind of predictors of long-term success. So finding the right kinds of foods and then trying to incorporate that as much as you can in a weekly diet is ideal. It never has to be perfect, Same thing from a training program. You don't have to do the fancy training techniques, just getting into a weight room or a fitness center, giving full effort and doing it on a consistent basis. Those are always going to be the most important details. So I think people just kind of get in their own way oftentimes when it comes to some of these. And the other obvious barrier to a lot of people is just time and finding the time to do things, whether it's cooking meals, shopping, getting into a fitness center. And so again, hopefully we can find creative ways for people to do those things more efficiently, and again, just kind of not get burdened down by some of the complexities that people like to make them be.
You kind of alluded to this, but I'll just to maybe sum it up a little bit. In your experience, what is a step or two people can take that might have the biggest impact on their health if they, kind of want to just start today? Anything that comes to mind?
I would say just moving more. If you are literally starting from zero, a simple kind of goal is to just try to get, at least 8,000 steps in a day if you can. If you're doing that, that means you're probably reducing the amount of time you're spent in a seated or sedentary type position. So that would be my first recommendation, is just to get up and move. And then if you want to add more focused activity to it, doing different mobility and kind of stretching exercises, if it's been a few years or decades since you've truly done a lot of activity, you kind of have to maybe work on some of those movement restrictions early on so that you can even exercise kind of later down the road. So that's sometimes where people get ahead of themselves, as they jump right into a 5K training program when they literally should be working on just some more dynamic stretching movements to make sure their body is kind of ready for that more structured or more intense activity. So that's kind of where I would start, is just to move more and do it on a consistent basis.
I like it. What has been the best resource that you found in helping just yourself and all of your own fitness goals, but then also that you've maybe provided to others? And it could be the same thing.
I would say one of the biggest resources that I found to be helpful is examine.com, which is kind of a massive database and helpful kind of website that can synthesize all the available research on a particular dietary ingredient, a supplement, or even kind of new different nutritional strategies. And it's just a massive hub of kind of evidence-based information that is kind of been interpreted by different experts in the field to, again, make it a really easy to follow just database of information. So that's, I think, one of the most helpful resources that I've come across, and it's also kind of user-friendly enough where the lay public could also benefit from it.
And then just to sum it all up, again, kind of already answered this, but we'll ask it again, in what you do and working with the board, obviously, and then also still being big on putting out content with Clinically Pressed, how do you make what is complicated simple?
So I think, again, going back to my background and doing a lot of research, I kind of understand how to pick out kind of the more important findings from a particular project, and then, again, kind of through the different roles that I've had, being able to interpret it, but then immediately kind of apply it or set up practical applications from some of those, different research findings. And then I think all of us are kind of down to earth and kind of realistic with a lot of our daily lives and expectations. Most of us have families, young kids, and so we kind of get the chaos of life, and then hopefully have figured out ways to kind of, incorporate some of, practicing what we preach, I guess, in ways that, again, a lot of other people could likely learn from and benefit as well.
Awesome. Well, that was Dr. Andrew Jagim, one of our original founding members of Clinically Pressed. Check out clinicallypressed.org. Resources will be continued to add there on the regular basis. If you're looking for any exercises, check out our YouTube channel. We're 200, almost 300 plus and counting for exercises and some mobility movements. So a lot of good resources there. And we'll be back next week with another board interview.